by the way, it's not necessarily incompatible with treatment participation and recovery. In fact, it can actually support recovery. But we want to characterize it properly for the sake of the decision tree.
And what factors might help you to stay in treatment?
Well, if he doesn't kick me out, that would help.
Well, that's pretty coercive,
Okay.
isn't it?
And do you have any probation or parole status these days?
No, nothing like that.
Nothing like that. Okay. How many times in your life have you been arrested or charged with, and I'll list a bunch of criminal offenses. You just tell me if you stop me if that.
Okay. And then we'll go on through, this is an ASI section on legal problems and arrests. But before we leave this, I just wanted you to see the pull-down menu on what factors might help you stay in treatment. And so, is she committed with no external pressures? Anybody think that? All right, so we wouldn't use that rating, it's pretty obvious. Does she want recovery but have some pressure? How many people would vote that? Raise your hand if you would vote that. Okay, there's some interest in using that one. Is she ambivalent and externally persuaded? Okay, more people are leaning towards that one. Is she ambivalent and external? Is she only in treatment by coercion? There's a couple. So you've seen a bell-shaped curve, and there's no way to avoid a bell-shaped curve when you're clinically evaluating people. Even in research, that's the case. But this was a very narrow bell-shaped curve. Many more people rated ambivalent and externally persuaded than the other two adjacent items. And that's a very good test of the reproducibility or reliability of a question item. So I use that to show you how the research world process has informed the construction of a clinical tool. All right, let's jump ahead to another section. Let's see where I'd like to take this to next. Okay. Click on your left-hand side in your tab browser window to the Family and Social History tab. And the first tab in there, the first sub-tab is Family and Social History. Anybody not there? Great. Beautiful. All right. So
For him.
we'll start in the middle here with what are your usual living
And how long have
arrangements.
you lived in these arrangements?
She has a boyfriend she's been
Yeah.
living with, so sexual partner alone.
Yeah. All right. And are you satisfied with the situation living with him?
Well, I would be, if, he would want me to stay there, but he wants me out.
He does? Okay. So that's not great. How about, is there alcohol and drug use in your current living situation?
Well, he doesn't drink, but he won't stop me from doing it.
Okay. All right.
Let's just look at that for the different options there. So, how many people would say her daily routine will gratify her recovery or her and shield her from substances? Okay, that's probably not a good response for the information we have. Do her free time, she has, actually you haven't heard this, she has said that she has no free time activities. She has no hobbies, no interests. She just comes home and drinks until she goes to sleep at night. So will her free time activities support her recovery? No. Will it permit recovery if sufficiently, can somebody tell me what it says because I can't remember? Motivated. Or will discourage or hinder treatment? Okay, so how many people think that discourage or hinder treatment is the best selection? Okay, a couple people. How about the previous one? Will permit recovery if sufficiently motivated. Great. All right, so once again, we have a very narrow bell-shaped curve, which is very good, just what we would want.
stop me from doing it.
Okay, all right. And with whom do you spend most of your free time?
I'd say mostly me. I'm by myself.
Are you satisfied with spending your free time that way?
No, I'm kind of miserable about it.
Okay. Tell me about alcohol and drug use in your free time activities.
I don't really have activities. So maybe that's a kind of a setup for my drinking.
Okay, so you don't have a lot of structure. How would you deal with any problems in your free time that put you at risk for relapse?
I really don't know.
Okay. Do you have any close friends?
No, just my boyfriend.
Just your boyfriend, okay. Tell me about alcohol and drug use among friends.
Well, I drink after work with coworkers, but I wouldn't say they're friends.
Okay. And that happens periodically?
Yeah. Yeah.
Okay. So, it's either drinking after work with people at work who aren't really good friends, or you spend time on your own, but there isn't much structure going on.
Right.
Would you say that's the case? Okay.
Yeah.
How many days in the past 30 have you had serious conflicts with your family?
Probably a dozen times.
Okay. And are those family members or other people? So let's not count your boyfriend as family.
Okay, so, well, my parents are dead.
Okay.
And I mean, you know, the rest of my family, I don't talk to them that much.
Okay, so you have serious conflicts with them?
No.
All right, but with your boyfriend,
Yeah.
okay. How many days in the past 30 would you say you've had serious conflict with your boyfriend?
Probably 12 dozen times.
A dozen times, okay. And have you had significant periods in which you've experienced serious problems with your mother or father?
Well, my parents are dead.
Okay. But before you lost them, were there significant periods where you had significant problems with them?
I don't remember. I think they were okay. I mean, you know, we weren't that close, but I don't remember significant problems.
All right, your siblings?
No, I don't really talk to them that much, but, you know, we get along okay.
Okay. And your partner, you told me yes. And how about children? Do you have any children?
No, never had kids. I did want to, but when my ex and I broke up, that was the end of that idea.
Okay. And problems, significant problems with other family members or close friends or neighbors or coworkers?
I get along with people in general. I mean, I had a couple of bosses who fired me for drinking.
Okay, so we'd say yes to that. In the past month, it sounds like you've had some serious stress with your boyfriend.
Yeah.
How about with the coworkers?
I don't think so, no.
Okay. Now, let me ask you some questions about abuse. Have you been emotionally abused during the past 30 days?
No.
Or how about physically abused?
No, I won't put up with that.
Or sexually abused?
No, my boyfriend's a good guy.
Okay. Who's the person or persons with whom you've had contact in the past 4 months and who's been most important to you?
Well, it would be John, my boyfriend.
Okay. Have you neglected or abused John or any other family members recently?
Well, I would say I'm always nice to him, but I wouldn't say I abuse him.
Okay. And how much help will he need to assist in your treatment? Is he prepared to get involved in your treatment?
I guess it depends on what I do. He might stick with me.
Okay. So it's not clear, but he would definitely need some help. What's the likelihood that you could cause harm to him or neglect him or any others?
Well, I wouldn't say harm. I'm not going to harm anyone, but I wouldn't say I'm a support either.
Okay. What's the risk that you could be hurt or victimized by somebody else?
Oh, I wouldn't say there's a risk of that.
Okay. Are you able to locate resources in the community and get yourself to them safely?
Yeah, I'm okay with that.
Okay. So if we think about the family problems, have you been troubled or bothered by family problems at all in the last 30 days?
No, family really isn't a big issue in my life right now.
Okay. But how about social problems, like with John?
Yeah, a lot. I feel pretty guilty about it.
Would you say considerably or extremely?
Extremely.
Okay.
Okay, so this follows the path of the ASI with some enhancement. So the ASI goes through a whole series of considerations before it asks for a summary score from the patient about how bothered or concerned they've been and how badly they want treatment. So that the patient has really considered a range of problems very specifically and measured them a bit before they're asked to do a final rating. And this is because it's a disease of denial. Patients often don't remember or keep in cognitive, conscious awareness all the different things that are getting screwed up by their addiction. And by taking them through this, we're really actually involving them in the process of motivational interviewing. So you can see that she actually gradually revealed more information, including right up to the affective part of the guilt she has about a relationship with her boyfriend, John, and the fact that she is not a mother today because of a breakup in the past with an ex-boyfriend that she had hopes would have resulted in her getting pregnant and having a child. So this is a very structured way of doing it because I'm showing it to you to get through this material, but you can see you can easily do this in a much more relaxed way, especially once you get past learning curve, and you get the same information or a richer body of information, and an experienced counselor would really do a great job of that. And being able to jump around and being prompted to ask these kinds of probing questions would get at the same kind of material we want to get at anyway. But the important thing is a novice counselor who does not know how to ask the sequence of abuse, neglect of others, emotional, sexual, and so forth, and then abuse or neglect towards others, all of which are important considerations and should be routinely done in every situation, not just when the patient looks like they might not be together. So this is a way for us to assure that all staff in our programs give every patient a chance to consider these different possibilities and get them rated in a rational and thorough way. Okay, let's go to the psychological section and see how psychological symptomatology is assessed. And I want to point out that we're not developing psychiatric diagnosis through the computerized interview. Because this is a tool for counselors and non-medical people, non-psychiatrists,
Have you had a significant peak?
we're not asking counselors to come up with psychiatric diagnoses. They're assessing the history of psychiatric conditions. They're going to systematically assess a range of psychiatric and psychological symptoms and problems, and they're going to characterize them very carefully, but they're not going to end up making a psychiatric diagnosis. So click on the psychological tab on the left-hand side and navigate down the subsections to the first one, psychological history. And go down to the question that says, have you had a significant period in which you experienced, ellipsis, serious depression? And these symptoms are grouped in sections. So there's an affective section, and then there's an anxiety section, and then there's a thought disorder section. So let's start with the affective section.
Yeah, I was pretty down when my marriage fell apart. I'd say maybe been like suicidal.
Okay, all right. How about in the last month?
I'm feeling pretty down about what's going on, but it's not like it was when my marriage ended.
Okay, is it serious hopelessness or depression?
Sometimes, yeah.
Okay. And in the last 24 hours?
Yeah, I felt kind of somewhat depressed.
Okay. And was this related to alcohol or drug use?
Well, yeah, definitely from drinking.
Okay.
Okay, very important point. Relating this to either intoxication or withdrawal, and distinguishing between those two, is critical in the Dimension 3 psychological and emotional and behavioral conditions and complications. Because, as those of us who are experts in this field know, any psychiatric condition